Okay, you're scared of going to the hospital. Even if you're not scared of going to the hospital, you know people that are scared of going to the hospital. And this has a term, it's actually called trypanophobia, which defines an extreme fear for doctors or medical procedures. We could just include the hospital inside too. Just know that it's okay. You're not alone. A lot of people have this fear, including health workers. They might come as workers, but many of us wouldn't want to be on the other side of the consulting table. We don't want to be on the couch or on the hospital beds as patients. So you're not alone. Though there are no statistics, but one American survey showed that 1 in 3 people actually have trypanophobia. This fear is justified. And in today's video, I'm going to list 5 reasons why most people are scared of going to the hospitals or seeing their doctors. Find out if you have one or all the 5 reasons as to why you're scared of going to the hospital. Now let's dive into today's video. The first reason why most people are scared of going to the hospital is the fear of bad news. And the doctor is always going to be the one to break the bad news to you. So many people carry illnesses and experience signs and symptoms that they know that they're medical conditions, but one thing that makes them reluctant to go to the hospital is when this is being found out. They play the ignorance is bliss card. This is very difficult, and we're being trained to be able to tell you what it is as it is, with empathy though. Please don't allow this to prevent you from going to the hospital. It's always better you come and find out. In fact, there's something misdiagnosis. That means a doctor doesn't diagnose properly. There's something called a false positive and a false negative. A false positive is you are told you have a disease that you don't have, and a false negative is being told that you don't have a disease which actually you have. So both are bad, but then always a false negative is worse than a false positive, because it's better you are assumed to have a disease and you eventually don't have it, because when you're being diagnosed, the treatment commences, than for you to be left assuming you don't have a disease and it progresses. Maybe unfortunately it progresses to a stage that little could be done about it. Please, it's better you find out you have a condition, and the earlier the better, so that it's being addressed quickly. We know that this fear is real, but then it's milder compared to you eventually finding out when there's little that can be done about it. The second reason people are scared of going to the hospital is some have an extreme fear for needles or any procedure that requires the use of needles. This is actually called trypanophobia. Some might have had bad experiences earlier or had been told about it, but nobody sees a needle and is happy to be punctured. I don't think anyone does that. So if you happen to have a patient that has that kind of fear, please, what you do is that you keep the patient in a very relaxed environment and ensure that you could be able to do the procedure in one attempt. If you're not sure of your capability, please call someone more competent to do it, because it gets more painful with more attempts being done in this kind of things. And if you have this kind of fear, let the doctor know. It's valid. The fear is valid, but we're being trained to actually keep you relaxed. If it's not necessary, we wouldn't let you to go through this painful process. The next reason is a lot of people are also scared of some medical procedures which could cause some degree of discomfort or outright pain. It's even worse with people that maybe had gone through the same procedure before and have an idea about it, or they are being told by other people, and there are also some that happen to have read about it online. So this kind of people would have some reasonable degree of fear about the procedure. Understand that there's no good health worker that would want you to go through this unnecessarily. It should be indicated, and for our procedures there are always indications for them, which we document too. Try to understand that you need these things, and we'll keep on reassuring you too Sometimes some procedures could be outrightly painful, and in these cases, as a health worker, you're advised to give analgesics to help the person. Some even require anxiolytics to be able to help them to be calm enough to undergo this procedure. As a health worker, because someone went through it without any of this aid, does not mean everybody must go through it without some of these aids too. You try as much as possible to ensure your patient is as comfortable as possible too. The next reason is that they might have embarrassing symptoms. Most times, any illness that has to do with the genitals or the bowel are embarrassing to most people. And understand as a health worker that despite the fact that you've seen a lot of naked people and have touched a lot of genitals medically, it doesn't mean that some of these patients still don't get embarrassed. You might be so carried away that you wouldn't know that it's still strange or uncomfortable or embarrassing to a lot of people. So it's your duty to reassure them. They need to know that you really care about them. They really need to know that you're not embarrassed, and you make efforts to make them comfortable. When it comes to this kind of things, especially when it has to do with the genitals, you have to have a chaperone too, especially if you're with the member of the opposite sex. This helps to a very large extent too. When the patient gets comfortable with you, he or she struggles less to be open to you. So listen to them when they're sharing, when you're taking your history, and try to reassure them too. When you're doing any physical examination too, it goes a long way. Then the last reason most people are scared of going to the hospital is because they're scared of judgment or shame that comes. And this is peculiar to people that have not actually observed many of the guidelines or advice that the health workers have given them. You can find this in people that smoke, or people that are obese and have been told to reduce their weight, or some that had failed to take their medications due to whatsoever reason it is, and things have become worse compared to the last time. It's not as if we condone such acts, but at the same time again, stop embarrassing patients, stop making them feel terrible. You're a bad health worker if you make your patients feel that way. So even in the course of trying to address some of their deeds or misdeeds, at the same time again, you have to encourage them, because encouragement and motivations work much more than being judgmental or shaming a patient. That's all for today's video. What do you think about it? Do you think there are other fears or other reasons that I had not mentioned? Let me know in the comment section below. I want to also hear about some of your experiences when it came to these reasons. If you've not subscribed to this channel, please subscribe and turn on the bell notification so you don't miss my new videos, which I drop twice weekly. Thank you very much, and I'll see you in my next video.